Hey, welcome to our explainer. Today we're diving into a condition that affects millions of people but is still, somehow, incredibly misunderstood. We're talking about endometriosis. Our whole goal here is to just cut through all the noise and give you a really clear, straightforward look at what it is, how it works, and why it matters so much. So, let's get into it. This is the condition that impacts about 1 in every 10 women of reproductive age around the globe. That's a huge number. So you gotta wonder, right? Why is it still so frequently misunderstood, so often misdiagnosed, and in many cases just not taken seriously? That's exactly what we're here to unpack. So here's our game plan. We're going to start with the basics. What even is endometriosis? Then we'll get into how it actually works inside the body. After that, we'll talk about symptoms and diagnosis, look at how the condition is managed, and finally, peek into the future of treatment.
All right, let's dive right in. First things first, what exactly is endometriosis?
Okay, so the official definition is super important here. Endometriosis is a chronic condition where tissue that is similar to the lining of the uterus, that's called the endometrium, starts growing outside of the uterus. Now, I'm emphasizing that word similar for a reason. It acts like the endometrium, but it's not exactly the same. And its location, the fact that it's outside the uterus, well, that's where all the trouble begins.
So where does this tissue end up? Well, it can show up in a bunch of different places. Most of the time, we're talking about the ovaries, the fallopian tubes, and the lining of the pelvis, but it can also pop up on the bladder or even the intestines.
And this right here, this is the absolute crux of the issue. See, the normal lining inside your uterus sheds and leaves the body during a period. But this tissue that's growing in the wrong place, it has nowhere to go. It's completely trapped. And that one simple fact sets off a whole chain reaction.
So let's move on and see exactly how this turns into a painful cycle of internal inflammation.
So here's what's happening inside the body month after month. First, just like the real uterine lining, this out-of-place tissue listens to your hormones. It thickens up and gets ready to shed. Second, when the time comes, it bleeds, right along with the menstrual cycle. But, and here's the catch in step 3, that blood has no escape route. So it pools, and that causes a ton of inflammation in the surrounding areas. And finally, over time, this constant inflammation leads to scar tissue, which we call adhesions.
And all of that, the internal bleeding, the inflammation, the scarring, that is why it hurts. It's not just bad cramps, it's a real, recurring, inflammatory process happening inside the body.
And the fallout from this cycle can be pretty serious. We're talking chronic pain, and it's also one of the leading causes of infertility. The adhesions we just mentioned, they can literally make organs stick together. It can also form cysts on the ovaries, called endometriomas. Sometimes they're called chocolate cysts because of the dark old blood that fills them up. Okay, so knowing all that, how do you actually spot this? Let's talk about the symptoms and the diagnosis, which, believe it or not, is often a really long journey. On average, it takes a staggering 7 to 10 years from when someone first feels symptoms to when they get a confirmed diagnosis.
Part of the challenge is that the symptoms can be all over the map. The classic sign, of course, is severe pelvic pain, particularly with your period. But it can also mean pain during sex, painful bowel movements, heavy or irregular periods, trouble getting pregnant, and even things that feel totally unrelated, like constant fatigue, bloating, or nausea.
And then, to make things even more complicated, you have people with no symptoms at all. Seriously, their condition might only be discovered by accident during a totally different surgery or while they're being evaluated for infertility. It just goes to show how sneaky this condition can be. So, the path to a diagnosis is usually a step-by-step process. It often starts with a simple pelvic exam, where a doctor might feel some tenderness or nodules. The next step is usually imaging, like an ultrasound or an MRI, to look for deeper clues. But to be 100% sure, you need to get a direct look inside.
And that direct look is called a laparoscopy. It's considered the gold standard for a reason. It's a minimally invasive surgery where a doctor can literally see the endometriosis lesions, take a small tissue sample to confirm it, and here's the really cool part, often treat what they find by removing it, all in the same go. It's both a diagnostic tool and a treatment.
Okay, so once a diagnosis is finally in hand, what happens next? That brings us to managing the condition, which isn't a one-size-fits-all thing. It's really a multifaceted approach. Now, let's just be super clear about this right up front. At the moment, there is no cure for endometriosis. But, and this is a really, really important but, the symptoms can absolutely be managed, and for many people, managed very effectively. Management pretty much stands on these 3 main pillars. First up, you've got medication. This can be anything from over-the-counter pain relievers like ibuprofen to different kinds of hormonal therapies that aim to suppress the cycle. Then there's the surgical route, like the laparoscopy we talked about to remove the lesions. And just as crucial is that third pillar, lifestyle and support. Things like regular exercise, an anti-inflammatory diet, and pelvic floor physical therapy can honestly be game changers for someone's quality of life. Finally, let's look ahead. It's important to talk about the long-term stuff, but also about the very real sense of hope that's on the horizon for treatment.
So it's important to know the potential complications. We've already covered infertility and chronic pain, but really severe adhesions can also mess with bowel or bladder function. And in super rare cases, the tissue can actually travel to the chest cavity, which is a condition known as thoracic endometriosis.
But, and this is a big but, it's not all doom and gloom. Not even close. The research in this field is moving so fast, and there are some incredibly promising new ideas and treatments being explored.
And this is where it gets really exciting. Scientists are looking into potential links with autoimmune disorders, and even things like stress early in life. They're creating brand new therapies that target the communication between our nerves and our immune system. Some researchers are even trying to repurpose existing drugs to stop nerves from growing into the lesions in the first place, which could tackle the pain right at its source.
So that's what we'll leave you with. As science keeps digging deeper and starts to figure out all these complex connections between our immune system, our nerves, and this disease, you have to wonder, what amazing new possibilities for real, lasting relief are waiting just around the corner? The future is definitely looking brighter.